Hi, everyone. Welcome back. We're going to talk about confidentiality and documentation, and this is the first video in our module on documentation. This is perhaps a little bit drier than our other content, but it's super important for behavior techs to know this information. It has a lot to do with ethics, acting responsibly as a behavior tech, and making sure that you're documenting everything you need to in case there's a problem. The first topic we're going to tackle is confidentiality, which is so important. It is a primary tenet of our ethical responsibility to our clients. They have a right to confidentiality, and we need to know exactly what that means. Who can you talk to? Who can you not talk to? And all that information. So why does it matter, the confidentiality? It's very important because it protects the client's rights and dignity. Maintaining it ensures that clients are treated with respect and their personal information is protected. And it is a law. So there's two laws that sort of dictate this. One is HIPAA, which is for private patients, patients in clinics, patients in home-based services. And then FERPA, which is the school-based law. So that one protects students' private information. They are very similar. They have very similar guidelines, very similar language. The rules are very similar, but you do need to know both, even if you're only working in one setting. Build trust with families and teams. Keeping everything confidential helps establish a relationship of trust between you, your learners, and the support network. It complies with our legal and ethical guidelines. So it's HIPAA and FERPA, as well as most professional ethics codes will have some sort of language about confidentiality. For BCBAs, RBTs, they definitely have that. Same with the other certifications. And then it also ensures accurate behavior intervention and database decision-making because through confidential documentation allows for effective treatment, planning, and progress. So what is confidentiality? Essentially, it is keeping private information private. Only share information with those who are authorized to receive it. How do you know who's authorized? For both a school and a clinic or private setting, the treatment team, meaning the parents, caregivers for right now, and then the people working with the learner, so the supervisors and the techs, that will most of the time be the authorized people. Anybody else, really, the information should be kept private. A tech who is not working with the learner should not get information about that learner. A supervisor who is not working with the learner should not get information about the learner. So occasionally there's an owner, a CEO, or a clinical director in charge of the supervisor and the techs. They would be part of the treatment team, even if they don't have a lot of hands-on support with the student or the learner or the family, but they do have the right to have the information. Legally, there's some language just about not like the whole company doesn't need to know every client's information, but there's cases where that kind of doesn't make sense because the company is so small. Like I've worked with a company who I was the only supervisor, so yeah, I knew every single client and all their information. So it sort of is very situational too for where you're working. There's giant companies in this field who have offices all over the country. And so, yeah, in that case, you really want to keep it tight within the treatment team and not be sharing it with Susie over in Texas that you barely know, but still works for the same company. So what this does is it protects clients' rights and dignity, maintaining that trust and help us comply with legal and ethical guidelines. Okay, the laws that protect and decide this is HIPAA, the Health Insurance Portability and Accountability Act, and it protects health information privacy. We call it PHI, private health information. And so that's a law that's going to guide if you're working in a clinic, home-based program, or hospital. And then FERPA, which is Families, Educational Rights and Privacy Act, is safeguards student records in the school setting. And then also the BCBA Ethics Code, including the RBT Ethics Code, both have information about it. Your agency might have more information about it. Agencies write their own policies about this. So those are the laws we're following. These are the common violations, and I'll talk a little bit more about this. Caregivers, parents. Most of the time, this is pretty easy, even when there's divorced parents or one parent. Like the person that signs the child up for therapy or the parent on record at the school, you can give them information about the student or the learner you're working with. But occasionally caregivers can be complicated, and there's situations where there's custody issues or legal issues with information. In that case, you'd be looking for, and you can request this documentation from the family, like documentation showing who has medical and educational rights. There is cases where someone might have medical and educational rights, but not the custody. I've seen it. So it does happen. I would say 95% of the time, the person with custody has the medical and educational rights, and you don't need to ask that. But there are occasions where that's not true. The person you would communicate with, and the only person you can communicate with, is a person with those medical and educational rights. And I've never seen them split. They're always together. And there's situations where there might be a court-appointed advocate to deal with the medical and educational rights. But that person's not related to the child. They'd be someone who they'll know the child because they'll spend time getting to know them. It's a job. You can do it too. You can become a court-appointed advocate. And so basically it's just a person who's underage or has a developmental disability who can't make those decisions for themselves yet, who needs someone to advocate for them completely independent of the family for their education, health, whatever it is. It's a volunteer position. You go through a lot of trainings, but it's a great experience if you're ever looking for some sort of volunteer position, and you'll help a child a lot by doing that. So that's one thing you can do, and you might have to work with someone like that at some point. You have to figure that out if it's not just like parents sign them up for therapy, even though the parents are divorced, they're both like come to the intake and all that, then you're probably sharing with both of them. You can always ask if you're confused by that and make sure. This is my other little tip with confidentiality that people don't think about. The person who holds those educational medical rights may share with anyone. That is their right to share the information with anyone. You cannot share with anyone, but they may share with anyone. When a psychologist calls and is like, can I get this information? I'm like, I don't even really you can have the parents sign that they can get the information, but the easier way is I take that information, I put it in a folder or a file, close it up so people can't just read it, and I hand it to the parents and I say, hey, your psychologist called me and wanted this information. Do you want to just deliver it to them? And then you're not signing anything. You're kind of out of it. So keep that in mind. It makes things a lot easier. When you get requests for information, when doctors call you for information, anyone, instead of doing all this paperwork to sign and talk to them, if it's like something you can write down, like reports or whatnot, just put that report in a manila envelope, seal it, hand it to the parents, and tell them who wants it. And now it's on them to give it to them. And that's their right to give it to them too. Talking about a client in a public area, so sharing information about a client in places where others can overhear. That's like the most common problem. If you're going to talk about a learner or a client, you want to go in a closed space where others can't overhear. Also, as a professor, a lot of us, when students were in our office, that was like their private information. Our offices, of course, it was a public university, so we didn't have the thickest walls. A lot of us bought a sound machine, just like it would make the static sound, and we'd put that outside our office, so it was harder to hear. You can look at technology like that to ensure that you have privacy. Sharing information with friends, even without names. You don't want to discuss learners' cases with friends, families, or members. Avoiding using the client's name. Posting photos or stories on social media. So this is a huge one. It's been a big concern of late in this field, but sharing details, photos, or stories about a client on social media platforms, even if you're keeping them anonymous, people are asking clinical questions in the group and asking for help. And they're giving information about a client. It's possibly enough information that if I know where you live and where you work, I can figure out the rest. So just don't do that. One, don't go to social media for clinical advice. Ask your supervisor. If they don't help, ask the person above them or ask a mentor. Really try to avoid posting anything about your job on social media. I got a new job. I got promoted. That's probably pretty safe. But other than that, I would never post about my job. Leaving documentation visible in your car. I've seen this happen, especially if you have to carry folders around, like a folder for clients and you're carrying it back and forth. Discussing a client's case in the break room. Break rooms are great. It gives everyone a place to chit chat. It's a hard field. There's a lot of burnout. Connecting with others is good, but you can't connect about clients. You should connect about other things like what it's like to be an RBT or a tech. How do you manage food if you're driving to homes? Like all that stuff. That's what's supposed to go on in the break room. How do you protect it? We're going to understand our laws, be aware of HIPAA, FERPA, and agency-specific guidelines. You're going to keep client information secure. The law for both HIPAA and FERPA are 2 degrees of protection. If it's in a cabinet, the cabinet's locked and the room's locked. If it's on a computer, the computer's password protected and the room's locked. You need 2 barriers to access the information. Same with your car. If you're going to carry stuff around in your car, you should have a case that you lock and you lock your car. Limited information sharing to authorized parties. So you want to only share with your supervisor and team members, nobody else, unless you have written consent. Be cautious of social media. Make sure you're not ever posting about clients, even anonymously, and use privacy settings to protect your own online presence, and document everything accurately. So make sure you're taking really thorough and accurate notes and no guessing or backdating. Okay. So never post about clients, even if it's anonymous. Clients' information must remain confidential. So don't post clinical questions like this. My learner's doing this, and this, and I was wondering what I should do next. Don't be posting that stuff. If you're going to post a picture, make sure you look around. If you're out with friends and you post a picture, then it's fine. But say you took a selfie right after therapy and your hair's cute, so you're going to post it. Look at the picture and make sure, can you see the address? Can you see what street that person lives on or whatnot? And if that's too, move your car a couple blocks and then take the picture and post it. Same with if you're ever taking pictures when you're in therapy, I would never post those. Same with if you take pictures in your clinic office and there's no students around, just double check that there's no information on that picture that could let someone know an identity of a client, someone's name. Sometimes we have posters with kids' names in the clinics where they're earning stuff or they get to move their picture around to what station they're at. If you took a picture and right behind you is the name of that kiddo, that would be a break in confidentiality if you posted that online. Avoid referencing your work. Ensure the post can't be identified with your work, and use privacy settings. It's good to do that anyways. The big reason is I highly recommend never friending families, caregivers, or students. If you're private, they can't search you. If you're going to work in a school or in these settings, you want those privacy settings so that they can no longer search you. When can you share information? So you can share with your supervisors or team members directly involved in the client's case. That's that whole team thing. In team meetings or supervision. So of course, when you're getting supervision, you may receive, you want to share all the information, and then as required by law. So mandated reporting abuse is required by law, so you can share. Everyone's getting additional training. When you do that, realize I would get nervous. This might not be abuse, but I'm not sure. Especially now I know, but when I was younger, I'm not sure. And I don't want to give the information about the person first. So if that's your case, you can call and say, I want to share information without a name, and you tell me if it's reportable to CPS or whatever the state's using. And the person on the line will say, okay, great, tell me what's going on. You share without sharing the person's name, and they'll tell you this is reportable or this is not reportable. If it's not reportable, you can't report it. But if it's reportable, then you give all the information. But I don't know that everyone knows that's an option with mandated reporting. The training doesn't always clarify that. with parental consent, you can get consent to share, do the full form, and then have a phone call with a doctor or a teacher. But you can't do that until you get that consent. So even though, like, you can make an argument that teacher's part of the team, if you're not working in the school, you actually can't share across like teams, I guess, across agencies, across services without the consent. So you can only share within your agency, and then you can get consent and then share with other outside agencies or outside service providers, like the psychologist, the occupational therapist, the speech therapist. Now, that changes if the speech is within your agency and considered a team member. Then you may share. But if they're part of a different company and they are seeing the kid, it's their speech therapist privately somewhere else, you need the consent and then you can share. Track progress over time provides a record of the client's behavior, skill acquisition, and response to intervention over time. What is documentation? We'll talk about this, and we're going to go more into documentation in the next few slides. Documentation supports treatment decisions, serves as evidence-based decision-making. It also protects the provider, the agency, and the learner if there is any regulation inquiries. The BACB might have regulation inquiries, the funding source, like they want to know exactly what's happening. And it also improves communication between everyone. This is about general documentation, all your data, all your reports, anything you're writing down. Why is it important? It's super important because we're tracking the progress over time. Ongoing documentation allows you to measure changes in behavior and skill development. Documentation provides evidence to make data-driven decisions about interventions, and then it thoroughly and accurately notes can serve as documentation in a legal event, and then it also helps with team communication. What's good documentation? It's objective. You're only describing what you hear. You're not describing emotions. You're not describing what you think you heard. And also, what's important with that is when someone tells you something, you write it that way. So if mom says, oh, he's tired because he didn't sleep, you didn't see him not sleep well. She's probably right. When parents give you those little bits of information, it's completely accurate. But you don't want to write it like he didn't sleep well, so he had more behaviors today. You want to state, mom reports, Johnny didn't sleep well. And then you can hypothesize that this might be the reason why he's struggling today. Complete. You don't skip steps or leave blanks in your notes. Accurate. Double check your numbers, times, and details for precision. And timely. Complete the notes right after the session ends, not later. And then use plain language that families and team members can understand. So data sheets, how we do timelines here, the data sheets right after session or right after the data's collected. The session notes, which we'll talk about, is documented at the end of each session. Your BERS, behavior emergency reports, within 24 hours or sooner per policy. Supervision notes are kind of a monthly thing. Those are the main documentation that a tech would deal with. Here's some common mistakes. Never backdate your notes. Backdating is a legal violation. It does happen. There's a lot of, if you look at, we'll talk more about like what losing your cert and what that looks like. A little bit, violations or ethics violations. A lot of them, they're primarily for techs, are people kind of just gave up and stopped communicating with the BACB. And so they probably don't want their cert anymore. It's not the proper way to do that, but that's a lot of the violations. The second most common violation for a tech is funding. So over reporting sessions to get more funding. There's backdated notes with that kind of stuff. If anything's off, you need to stop what you're doing and really look. There's a couple steps you have to go through. Make sure you didn't do an ethics violation. If so, self-report. If the company as a whole is problematic, you have to report to the right agencies and probably quit and find another company. That can be a really big deal. It can be a big court case for you. It's not something you want to get involved in. Avoid leaving blanks. Don't guess on your data. So don't be guessing. If you don't know because you forgot to take it, write that. Refrain from batching notes. Don't keep copying notes over and over and over. or waiting to complete the notes, and use language that everyone can understand. With these notes, the parents might read it, so keep that in mind. Use language they can understand and use really positive, objective language. Like, we're not going to say, oh, he was horrible today. Say, like, he had a lot of behaviors. He had 10 behaviors today. That's truth. It's not negative. It's not really it's not positive, but you can't really call that negative. Ethics and honesty. Falsifying documentation is a big ethical violation. It can lead to the loss of your credential, legal consequences, and termination. So you never want to falsify. If you don't know, you can write that and say, I made a mistake. I should have written this down and I didn't in time. You'll probably get more training and we can move on from there. But if you do this purposely, it can cause a lot of trouble. Be honest and accurate. So always never guess or backdate. And then when in doubt, you want to ask your supervisor. Reach out for guidance on documentation policies and best practices. If you don't feel like you're documenting correctly, always ask for help. Okay, your role is to maintain your client's confidentiality, protect the information, and only share with authorized individuals. Take accurate and honest notes. Document immediately. Don't guess. Don't backdate. Ask questions if you're unsure. Consult about policies. Ask if you're doing things right. All those things. And report any concerns to your supervisor. If they're not receptive, report above them. Like, keep going. You don't want to get in a position where well, they told me it was okay, but I don't feel like it's okay. You don't want to be in that position. You want to keep asking for help. Treat documentation as part of therapy. Documentation is crucial. Don't forget it. It's a huge part. We talked about how important data is and taking data. The other parts of documentation are just as important. Imagine this might be read in court. Don't write anything that didn't happen or anything that you wouldn't want people to read, like the whole world to read you wrote, even though that will 99.9% not happen to you, you still kind of think that way so that everything looks clean. Protect your client like you protect your own child's information. I think about my children, and I do share a lot about them here. They change so much, and I've talked to them about it. They really don't mind. But when you think about it, if you had a child who had a medical problem, and that medical problem, though it doesn't affect them right now in school or any other situation, if people knew the medical problem, they might treat them differently. It's not your right to share it, and the parents and the child might not want people to know it because they'll treat them differently. So it's important that you protect it. You protect it in a way that you would protect your own child's information if it would make other people look differently at your child. We all do it for our children. There's lots of things that we wouldn't share with the world because it could make the world look at them differently. So you want to protect these clients' information that strongly, just like it's your own. Okay, thank you. I'll see you next video.